Hello and welcome to Unlocking Health with Dr. Lexi. Today I have Karan Almond here again with me, and we're going to dive into cavitation. So this is part 2 of our dental series. And Karan, welcome back. I'm so excited to have you.
Be back talking about one of my favorite subjects.
I'm going to switch the screen here real quick because I want to make sure I actually look like I'm looking at you. Hang on a second. Okay. All right. So Karan, let's start from the basics. What the heck are cavitations?
That's a loaded question, but in the simplest terms, a cavitation is a hole, and it refers to a hole in the bone. And if you want to get really fancy, you can call it a NICO, which is neuralgia-inducing osteonecrosis. um, Or you can also call it, I think now they're calling it fatty degenerative osteonecrosis. It's been called ischemic bone disease. So basically, the underlying problem is that something is causing a problem with the bone cells, and it's creating space or a hole in the bone. And sometimes it can be one big hole, and sometimes it can be several small holes in the same area. And so when you have these holes like this, often the blood supply can be disturbed. So if you have the blood supply disturbed, even if you have hypoperfusion, the body can't always, especially if the rest of the body is taxed and the resources aren't there, it doesn't always send in the army to clean up the organisms that like to live in that area.
Right.
So these are usually silent infections. And I say silent because until they're pretty severe, most people, unless they have nerve damage, most people don't know they have a cavitation. So I'm going to let you kind of ask questions because right now I'm feeling myself, I could launch into a 40
you're you're fine.
and I don't want to do that.
So what leads to a cavitation? Is it a dental procedure or is it just an infection in the mouth? Like what types of things would lead one to have a cavitation?
So there's an image, and I won't ask the screen share to pull this up, but imagine an elephant and imagine somebody on top, in the front, on the side, underneath, and that's all they've ever seen. And they're describing what this thing does, what's making it look like this. You're going to get a whole lot of different answers. If they're behind the ears, it might seem like a fan to them. If they're on the side, it might look like it's a wall. If it's from the front, it might look like a big water hose. So, the problem with the cavitations is for a long time, it's been denied, both in the medical industry and in the dental industry.
Mm-hmm.
When I say denied, it's not that they're saying it isn't there. There's been proof that it's there. But because it doesn't come with the same kind of symptoms as maybe in other bone, they don't often think anything needs to be done about it. In other words, there's no medicine they can give you to band-aid it, and they don't feel like if the tooth is not there, then what's the problem? What they're not taking into account is that there are all these very complex biochemical processes that happen to keep the bone building in your jaw. I think we talked about this, maybe we didn't, maybe it wasn't you. I was talking about root canals with someone, but when you have a root or an implant in the jawbone, it tells the body, hey, I've got something there I need to support and hold in so I can eat. But if you don't have anything there, then the body doesn't know it needs to come lay down more bone. It's going to lay down some bone, but it's not going to lay down enough to make it really dense, because the body can use those resources somewhere else in the body where we need it. And so this idea of laying down bone, if you think about the fact that the bone turns over every 90 days, so you get old bone cells going out and new bone cells coming in, there's a lot of activity. There is a difference in the bone of the upper jaw, the maxilla, and the lower jaw, the mandible. There's also a difference in the bone in the posterior bone and the anterior. The other thing that's different about this bone is that nowhere else in the body do we have anything sticking in the bone. We have all these tooth sticking in this bone, and we have a communication. particularly if you get a root canal. There's a way for organisms to get in there and seep out into the surrounding bone. And a lot of them like to eat the bone for minerals. So you can get these cavitations even around a infected tooth, and especially a root canal, because a lot of times, because the nerve is dead, people don't know that the root canal is infected. And just a little mention here, a root canal is dead tissue. There's no blood supply going to the tooth, and there's no blood and lymph supply coming off of
anything.
So it's really, I call it like spring break condo, where the unruly kids go and the police get there.
So let me ask you, I know a lot of people have bone loss in their jaw, right? For myself with the lupus, I started losing tissue and some bone. So could that be just cavitations? I mean, can it come from just normal infections besides dental things I can start eating away?
Yeah, I mean, there's all kinds of systemic issues, and it has a lot to do with the immune system. Because there's a lot of inflammatory, pro-inflammatory processes that go on in the bone. And, inflammation isn't necessarily bad, as you know. I mean, sometimes inflammation
Short term, it's great, right?
Army to come in and heal an area, right? But if you've got a lot of inflammation going on in your body, it might not be able to handle the inflammation going on in the jaw. Now, for somebody who has like osteopenia, osteoporosis, if they put them on medications, a lot of those medications can lead to osteonecrosis of the jawbone. So, dealing with the osteopenia another way is ideal. So there's a lot of things that can happen. There can be tumors, and I don't want to say that because most people who have, they're not, they don't have a tumor, but it can happen. So it really is, if you think about it, the biochemical processes in the body are there for a reason. And if the body's out of balance, then the mouth is going to be out of balance.
Right.
If the gut's out of balance, the mouth is going to be out of balance. And the question is, where are you kind of genetically have a propensity to have a problem? So you can have it from other reasons, from medications, other systemic issues. I think lupus is one. See that? And I think you said that has happened to you.
Yep.
There's 4 types of bone. So a type 1 bone is the best. It's ideal. Most of us women at our age, post-menopause, we don't have type 1 bone. But what we don't want is type 4 bone. And type 4 bone is really much less dense. And it's kind of like
spongy.
Between looking at, your sweater that's all together, and then you pull it apart and you get like coral in there. All this space in there. So most of the people that I work with, and what most people are starting to realize, is that there is a dental connection to systemic symptoms. And when we have a root canal, that's a no-brainer. There's organisms in there, and they can go acute. They're usually chronic, but once they go acute, you've got an infection, and you need to go do something with this tooth, because those organisms start to spread and the inflammation starts to spread. So you get swelling and fever and you feel sick. When you have a cavitation, it doesn't always go acute. In fact, it rarely does. If they get osteomyelitis and it starts to spread, and that does happen, but that's happening because the body can't heal. You have to look at what's going on in the body. It's not just, I have this infection in my jaw, and if I just got that taken care of, I would be fine. That is the case for some people after they've had an extraction. But for others, they go have surgery after surgery and they still don't feel better. And with my clients, they're highly toxic. Their guts are a mess, and they just don't have the resources to heal after surgery. So when you get on a lot of these support groups, people who have had cavitation surgery and they feel better, they will be like, yeah, just go have the surgery. And I'm like, hold up. Let's see if you're ready for that surgery, because most people have at least one cavitation in one of their 4 wisdom tooth extraction sites. A lot of us our age, we had our teeth removed prophylactically, and they're taken out by an oral surgeon. Now, how does a cavitation form? So I have to tell you a little bit about the process of extracting the tooth, because that kind of determines what's going to happen after. So when you have a tooth, you have the enamel on top, and that's hard. What
Mm-hmm.
people realize is that there's very soft tissue kind of underneath that. And then you've got all the hard bone surrounding it. So your root is living tissue.
Right.
And inside there, there's a pulp chamber. And that's where you have your blood supply and you have your root. So when you have a root canal or when you extract a tooth, you sever the blood supply. So there is some blood supply that's lost. So you want to reestablish that. So the first part of a proper extraction is getting the tooth and all of the root out and not leaving any root tips behind, because that will cause cavitation and infection as well. The second part is taking time to do what's called a sequestrectomy. And all that is a big fancy word for cleaning the site and debriding it. So when you have an infected tooth, or even if it's not infected and it's just you're removing the wisdom teeth prophylactically, wisdom teeth they usually have 3 to 4 roots. So it's a big area. And so when they pull that, that leaves a big hole in there. If they go in and they debride the bone all the way around the socket so that all the bone is bleeding, okay? And then that blood comes into the socket and it forms a blood clot. And the purpose of that blood clot is not only to kind of protect it, but there's a process called angiogenesis where blood vessels will grow back through that blood clot to create collateral circulation. So you have new blood vessels that will go through there. And that's kind of like the superhighway where it allows all the constituents that will bring in the bone and fill in that cavitation from the bottom up or the top down, depending on if it's a lower or upper tooth, and pack it with nice dense bone. If that doesn't happen, then there's a pretty good chance that you're going to have at least a small cavitation there. So a lot of the people we see with cavitations are actually older. They had their wisdom teeth removed a long time ago. They never even knew it was there. I'll just tell you a couple of stories. So there was a woman that flew in to see the dentist that I refer to, and she complained of having John Lennon glasses inside of her eyes, which of course she was sent to a psychiatrist for.
Mm-hmm.
But I believed her, and she had some quirks. But I also know you can be quirky and still have
Your faculties. Yeah.
quirky. And I had real symptoms and I got referred to psychiatrists. And I probably didn't need to go see the psychiatrist, but I still had the symptoms and they were very real. And I was fortunate enough to find doctors and dentists who found out what was going on with me, in addition to my own research. So when the surgeon that did her work did all 4 cavitations at one time. And on the second cavitation, she claimed that the opposite eye on the opposite side completely cleared up in terms of that ring. Then when they did the other side, she said that it all cleared up except about the 12-3 mark. And the last time I talked to her was about 6 months, 8 months after that.
Mm-hmm.
And she had reduced, but there was like still a dot. So what happened? I haven't heard from her since, but that was pretty dramatic. The other one was a guy who had frozen shoulder. He'd had it for years. He didn't want to have surgery. And he didn't even know that the cavitation might be related. He actually came for a different type of infection, and the dentist found the cavitation. It was right next door to the cavitation. The cavitation was right next door to the second molar that was infected. And so when they did the extraction and cleaned up the cavitation site, he stretched and he went like this and he went, oh my gosh, I haven't been able to do that in years. And I don't know what happened with that either, because he wasn't my client. I was there. So, there are some pretty dramatic systemic things that can happen when you remove a root canal tooth and you clean up an infection.
And I've seen it a lot. I work a lot with tinnitus clients and I see that inflammation just goes right there. I wonder myself if that cavitation spreads into the mastoid bone, and that might be part of what causes mastoid infections or things like that. Who knows, right? Because it's all soft, spongy tissue. It's very, I don't know. I just kind of throw stuff out there, but
the nerves are involved with the tinnitus, right?
Uh-huh.
Another thing that happens. So because some of those roots are long and they're
Mhm.
close to the nerve. So you have a nerve that runs off of the TMJ and that whole nerve bundle in here, kind of on the mandible and on the
Mhm.
maxilla and up here. So
Right.
if you think about this nerve that goes here and here, if you've got tooth roots that are near that nerve and you've got infection, or you get a cavitation that kind of continues to consume the bone and it impacts that nerve, you can actually get demyelination of
Mhm.
the
Mhm.
sheath of that nerve. And so I think that a lot of times it's very difficult to tell until you get these cleaned up whether the problem is coming from your TMJ area in terms of pain or
Right.
whether it's actually coming from that.
So when you go into the dentist, if they're not looking for it, is it going to be difficult for them to find?
Depends on who the dentist is.
Hmm.
So, because some of them don't even believe in it. I mean, they
Right.
don't believe that anything needs to be done about it. Some of
Do-
them are a little scalpel happy as far as I'm concerned, and they're just ready to
Mhm.
cut somebody.
Mhm.
And it needs to be cleaned up. But my question is, are you ready to go through that surgery and to heal properly? Because I've worked with a lot of people who have had more than 2, 3 surgeries on the same area, and it's not helping. So the question then becomes, well, what's causing it? I mean, if it really isn't surgical technique, and I will tell you, sometimes I believe it's absolutely surgical technique, because the 3 surgeons that I refer to, I've never had anybody come back with a reinfection. Well, actually, that's not true. I did have one girl who came back, and she came back to the same surgeon, and he cleaned her up again, and she did amazing the first time, and then about 5 years later, it came back, and she also has some other systemic issues
Mhm.
because there's let's see, can we screen share so I
Yep.
can?
I gave you access, so you should be fine.
You did. Okay, let me see here. Because what I want to do is see if I can give a little bit of a visual.
So to find it, is that where like a cone beam would come in?
Uh-huh.
So a lot of doctors I know don't use
There's
cone beams.
there's there's 4 ways really
Okay.
that you can tell. So the first way, and this is not the ideal way, this is the least preferable way, is a 2D X-ray. And in a 2D X-ray, you need to have about 30 to 50% bone loss to pick it up.
Mhm.
And so it's really not the ideal way, because that would be a significant cavitation. Sometimes you can see them, but that's really not how it should be done.
Mhm.
So let me back up just a little bit, and then we'll go to how we look at it, because I really want people to get an image of what it looks like. Now, this isn't what every cavitation does. This is kind of just an example. But you've got the tooth here, and you see you've got this little tiny, skinny, thin chamber where the root and the vein and the artery, the lymph, the nerve is all at in here in this root.
Right.
Then around this, you have the periodontal ligament. And, one of the other issues is this ligament is an area that has a lot of, I guess, nutrients, because the organisms like to live around that ligament. So when you go on dental groups, you'll hear people saying, make sure your dentist removes the ligament. Tell them to remove the ligament. And then people will come back and say, well, I told the dentist, but he said it comes out with it. So to clear that up, the ligament is like a hammock that the tooth sits in. You can see here. And when you take the tooth out, it usually between what clings to the tooth, it's like a membrane. What clings to the tooth and what is suctioned up, because the assistant will have suction right there. Between those 2 things, it usually does get most of the ligament, probably even gets all of it. But there are times there's little tiny fragments of it that can be left in this site. And that can be a source of infection if there are organisms living around it. So the bone, let's just say this is normal bone. So when you have a tooth removed, and let's just say this was the tooth removed, right? And you've got a little area here, and these organisms do what's called fistulating in my language. So they form a fistula. So it's nothing more than tunneling a hole. They can
Right.
tunnel a hole through bone, but they can also, if a site gets really infected, and this usually happens more with root canals, they can literally tunnel a bone through the gum tissue, and you'll it tastes like infection. It's a significant infection in there. As you can see, sometimes the bone will try to encapsulate itself, like form almost like a cyst around it.
Mhm.
So they've got this big tunnel here, and the bone that's coming back in here and filling in is going to look different. It's not going to look like this bone. And then you get this big hollow space here. And in this image, this one has impacted the nerve. And you can see that, it's caused some damage to the nerve. And so you could get referred pain going back or forward from that nerve. And so a lot of times people might think they have TMJ pain. They should also be looking to see if they've had teeth extracted, if they have a cavitation in there. Then this is just kind of an image showing like where you might see a cavitation, but this image doesn't really tell you a lot, and it's kind of scary. So we're going to pass that because it's not what it really looks like. So the next way to tell is a cone beam, and this is not a cone beam. Let me see if we have a cone beam. Oh, here's the image of the elephant. That's what I was talking about before. Can you see that?
Yeah, I can.
Sometimes when I switch. Okay, so this is a pano, but a cone beam can look like this as well. And so when you look at this, I still can't tell here. There's a little dark area here. There's a little bit of darkness here. There's darkness here. This is where the nerve comes out. But someone who's trained to read these can sometimes look at these and find cavitation. But the cone beam is 3D. So even though it will do a pano, it'll also, it's going to see if they had any images of it. Just so you can see it. So this kind of shows you why dentists may not see it. This doesn't really look that significantly different than this. However, this is a cavitation here. So if you're looking on a 2D, it's difficult to see. I'm not going to stop on the gross pictures just yet. I don't want to use that one. Oh, I thought this had one, but it doesn't. But so just so that you understand what a cone beam is, it's a 3D image that you can navigate. You can move it around. So you can look at different angles of the teeth, and you can look at slices of bone. And my favorite one, and that's probably because the one I was, the dentist that I worked with had this, both of them did. And I learned to navigate them, and it's called a plan mecha. The plan mecha will, it will show you what's called Hounsfield units, which are numbers. And it helps you identify what type of bone is in there. So let's just say that this was not sort of a pano image and we were able to navigate this. See my cursor?
Yep.
Put my cursor up here in the sinus. We're going to get like a negative 1,000 or so number because there's nothing in there. There's no density. If I put my cursor here on this tooth, we're going to get like a positive 1,000 or so because that's very dense. So when we come down here to the bone, we usually get numbers between, 100 to 400, 500, 600. When we start seeing numbers less than 100, especially if it gets down to less than 50 or negative numbers, then we know, oh, we might need to look further. There might be a cavitation here. And now some dentists don't have the ultrasound to look further, and they've been doing this for a long time. And obviously they start to see what is really indicative. And the dentist that I work for, he's pretty good at looking at the cone beam and knowing that there's going to be a cavitation there. However, what he has is called a cavitat, and it's an ultrasound. The reason not many dentists have these is there's not many left. This naval engineer, sonar engineer, actually developed it because he had cavitations, and he's like, there's got to be a better way other than just cutting into tissue to find out if there's a cavitation there. So he developed this ultrasound for the jaw. A bunch of dentists bought them, and then the FDA caught wind of it, and they're like, oh no, you cannot do this and do surgery based on this. This is not approved. So you can't do surgery just based on this right now.
Mm-hmm.
Cavitat, once when Bob Jones died, he took his plans to the grave. He got, a little bit of a, bug in his ear about all that. And he was like, okay, fine, then I'm done. So the people who have the cavitat, they can't even, unless they have somebody who's very good with fixing things, a lot of them don't know how to fix them. They have to figure it out. So there is a Dr. Johann Lechter. I believe he's in Europe. Yeah, he is. And he's maybe in Germany. But anyway, he's put out this really cool book that really goes into a lot of deep detail on cavitations. And he has created what's called the Cavita. And I don't think it's been approved yet, but they're working on FDA approval. So the hope is that more dentists here in the US will have the ability to do the ultrasound, because what this does is this looks kind of down at the bone. Now, when you see green here, like each of these blocks is a tooth. So like number 17 is your lower left wisdom tooth, 18 is your second molar, and then and 19 is your first molar. So we see cavitations more often in the second and third molar areas. They can be in other areas, but what we're looking for is green. Green means that you got nice, dense bone. Yellow means that you might have a few areas, but that doesn't mean that you have a cavitation there. When we start seeing this red, it's a cavitation. And the ultrasound will grade it 1 through 4. So if you have a 1 or a 2 and you're not symptomatic, you may not need to go do surgery on it right now, but just keep an eye on it because they can get bigger. Once they get big like these and they're a grade 3, 4, whether you're symptomatic or not, you kind of probably need to have that surgery, because once you've got that bigger area, then you don't want to have that infection encroaching on the nerve.
Right.
And then
that's fascinating.
Just kind of so people know, listen, just here's a warning. If you get squeamish, just look away for a minute and I'll tell you when you can look back. So when they go into the site, they go in, some go in on the side, some go in above. But what we see coming out of these is something that looks a little bit like this. When you open the site up, sometimes it's kind of pressurized and you'll see almost what looks like an oil slick running out of there. And then when they go to clean it up, you'll find all these fatty deposits in there, which I think is interesting because we've talked about how toxins are held in the fat. But I wonder how involved toxins are in these areas.
Goodness gracious. So is there any way to resolve them without surgery if they're small?
Well, I mean, I have one that I managed, and it was small. I managed it with ozone for years. But so for those who don't know what ozone is, it's just a hyperoxygenation of an area. And if you put all that oxygen into an infected area, especially into like a root canal tooth area, the organisms are going to scatter because they're not safe anymore. So it's kind of like if you go in and you roach bomb your house, it's okay for a little while, but then they come back. Right. So most of the time until you find the source, right? And get rid of the source. So your grocery store has paper bags with roach eggs in it. You're going to keep bringing them in. And it's kind of like that with an infection in the jaw. They're going to come back. I know, I'm so good at describing things, right? And so, but if you put ozone in there and you get relief of some symptoms, that can be really a cool diagnostic way to find out, oh, maybe I do need a surgery to clean this up. Now, sometimes, especially into a root canal tooth area, you put ozone in there and it gets worse. And that's what happened to me. And it got worse because I had all root canals. Okay. So this doesn't usually happen with one tooth. So I don't want to scare anybody, but I had such infection and I knew for over a year and I just wasn't ready to extract. And so when they put ozone in there, because I was having such pain, it did open up a fistula to the gum. And that really was my sign. Okay, I got to start extracting. Into the cavitation area, it's the same thing. They just put ozone in. It's either done with a needle or what's called an X-tip. The X-tip is like a little screw that goes in, and it's a kind of like a needle that you can stick a little flexible hose through. And you can put the ozone gas in that. And because ozone is a gas, it kind of spreads out everywhere. So to get to the deeper infections, you kind of have to use what's called an X-tip instead of just a needle. Also, if the bone is really mushy, you can get the needle in there, but a lot of times you don't know exactly where the bone is mushy. So X-tip is better. Put some ozone in, see if you get any relief. Now, in terms of, people have a lot of magic potions and things, rinses and, things they put on the gum. I'm not saying they can't help, but what I am saying is those things are not going to get deep enough into that bone.
They're surface level. Mm-hmm.
If it's a blood flow issue, unless you can find a way to get those blood vessels to regrow in that area, you can't do it. The whole reason to do it is the sequestrectomy, to debride the bone and let the blood clot form to make a medium for the blood vessels to grow in so that you can heal the area.
Mm-hmm.
It really is that simple. It's a whole complex process to understand it all, but it's, and these surgeries are usually not difficult to heal from. Most of them are fairly simple surgeries. If somebody's doing that surgery in 15 minutes, they probably haven't done a good job.
Okay.
Take their time. It takes a good hour. Now, there are some people who work really fast and they do a good job, but most of the people I refer to, they take a little more time.
So you had talked about the fat pockets in there, as far as toxins being stored in the fat pockets. So do you think someone should do a really deep cellular detox prior to having the surgery, or do you think that should come after the surgery?
Well, the reason I think that you should is because most of these dentists are recommending that you take vitamin D and you take K2 and a lot of them boron.
Won't get in there. Okay.
Nutrients. Well, we know that if you have cellular damage, you're not taking up those nutrients and your biochemistry is not doing what it's supposed to do.
Mm-hmm.
And, this is an interesting example. A lot of people don't know this, but on the back of the tongue sits some bacteria that are responsible for creating a lot of the nitric oxide in the body. And we need nitric oxide for cardiovascular health, right? Well, if you're gargling with Listerine or alcohol-based mouthwashes or very astringent things because you're trying to keep the bacteria out of your mouth, guess what you're doing? You're actually killing the nitric oxide forming bacteria. Mm-hmm. And no one is making those connections. So if someone has low nitric oxide, first thing I'm going to ask them is, what kind of mouthwash do you use? What mm-hmm. things put in your mouth? And here's the other thing. A lot of people think, I got to get all the bacteria out of my mouth. Well, no, you don't, because actually there's bacteria in your mouth that you want there.
Right.
And the bacteria that's in the bone, bacteria that's in root canal teeth are anaerobic acid-forming bacteria. They are not the bacteria that reside in the oral biome. Mm-hmm. And if you get some in your mouth from your fingers, when you swallow, your system is going to take care of those because they can't live in the presence of stomach acid usually. And there are some that live there, but it's not like, I've got all these bacteria in my mouth and this is what's causing my infection. And if I just rinse my mouth with this thing, it's going to get better. It just doesn't work that way.
Symbiotic. And, you bring up a great point with the nitric oxide, because we are supposed to be breathing nasally, which increases our nasal oxide production. And you won't have so many of those bad microorganisms proliferate in the mouth if you practice nasal breathing instead of mouth breathing to begin with. And, one thing else that you mentioned earlier that I really thought was good for people to really focus on was that the microbiome what we think of as just the gut actually extends from our mouth down to our gut, and then it branches out to our neurological system, our skin, cardiovascular, everything. So we have, 6, 7 different microbiomes throughout our body, probably way more than that. But if you have any gut issues, you very well may have a greater likelihood of cavitations as well. So, um, so, I know we touched on this last time we talked, because I think it's great for people to get checked out for cavitations, especially if they're not sure if you've been trying to heal from various illnesses or detoxing, be it mold and, heavy metals and all of these things. If you have underlying infections going on, it's going to be hard for your body to know what to tackle. What should someone look for in a doctor? Do regular doctors do this, or would you recommend someone see a biological dentist?
For the cavitation.
Mm-hmm, mm-hmm.
So unfortunately, it is going to have to be a biological dentist, and it needs to be someone who, and this is the hard part, because when I first went into working in the field of dentistry, after I kind of went through my own things with it, and I didn't want to go back to nursing, and I thought I wanted to learn more about dentistry, we called it ischemic bone disease, because we really couldn't even say the word cavitation, So at that time, there was nothing on the website about cavitation. It's a little more accepted now. It's not frowned upon as much. But what you really want to do is find out from your dentist, like you really need a comprehensive evaluation.
Mm-hmm.
Going to the dentist and going, well, I think I have this problem with this tooth. Almost every dentist will look at this tooth and tell you what that problem is. And if you don't want to do a complete comprehensive evaluation, most of them won't force you to do it. But here's the thing. You start doing one tooth at a time. You really do become, it's like whack-a-mole dentistry, and you become business for the dentist. So that is a strategy for some, and I'm not saying all, and I'm not saying it's a conscious thing, let me do it. It's just what happens. Some dentists don't want to tell you, oh, well, gosh, you've got, 3 amalgams and you've got 2 root canals and you need to lose some teeth and you need then people start to go, oh, these dentists, all they want is money. So the first thing you really have to do is establish trust in a dentist. You have to have the trust that dentist has both skill and integrity. And if you don't trust those 2 things, you need a new dentist, because they can have skill and no integrity, and they can have integrity. And I'm sorry, but there's people who graduate at the top of their class and go on and do a lot of continuing education. And there's people who graduate at the bottom of the class and they don't really do anything else other than what's required. And so, as we used to say in medicine, doesn't matter where you graduate in your class, you're still called doctor, right? So unfortunately, to become an informed consumer of dentistry, it really is up to you to start doing some research. That's part of why I decided to leave, offices and nursing and working for other people and do the consulting, because even in the office I was in, by the time the people would realize that's what they needed, they had already been through so much and spent so much money. And I was one of those people. I had already had 11 root canals and, 7 surgeries just with the endodontist, and spent a ton of money. And I kept telling him, I kept going, I really think that my Lyme disease and my mold illness is what's causing some of this. And he was like, well, it could be. And he was nice. Don't get me wrong. I mean, he did, for an endodontist, he did his job well. But I ended up with my whole upper right root canal and, 2 lowers, molars root canal. And that was the worst thing that could have happened for me. I probably didn't even need all those root canals, to be honest with you, because he was going a lot on the pain I was having. What nobody was realizing is that with all of the inflammation in my body, this whole nerve, because I have pain up my face, on the side of my face, and it was the most intense pain. It's like I just couldn't even keep my eyes open and move my head some days. So he was really trying to get me out of pain, is what he was doing. But what it did is it left a lot of long-term damage that had to be cleaned up. And so, going to a biological dentist, yes, but not all biological dentists are created equal. I
Right.
would look for someone, obviously you can meet with me and I can refer you to the dentist that I refer to if you can travel. I'm in Maryland. Um, but I don't refer to dentists that I have not worked with and I haven't witnessed their skill and integrity myself.
Hmm.
Fortunately, I don't refer to a lot of dentists. I'll look at websites for people and I'll say, yeah, their website sounds like they know what they're doing. Or, yes, I've heard them at a conference. I know they know what to do.
Hmm.
And the other piece of this, a lot of people blame the dentist when they don't heal. So going back to your point of detox, if you don't have the resources to heal, that's not the dentist's fault. It doesn't mean he did anything
Right.
wrong. His job is to clean up that site. Your job is to clean up your body.
Yep. Yep. And,
So I would say that with the detox that we do,
mhm.
I want to go back to the mold thing. I won't show it here because it's for people who are mold toxic. I don't want that image in your head.
Mhm. Mhm.
Really seen images of black um, debris that's taken out of the site that's aspergillus.
Mhm.
Um,
Mhm.
so we know that mold can impact these areas. We know that heavy metals can settle in there and impact these areas. So, and we now know that with root canal teeth, we find Borrelia spirochetes in those teeth. So they can get into the jaw too.
Right.
And so, the question then becomes, what do you tackle first? You got Lyme with all the things and the mold, and I really think that, you know, if it's truly like an just an overwhelming amount of infectious organisms that you kind of need to tackle that a little bit first.
Mhm. Mhm.
But then before you do surgery, minimally, I think somebody needs to do the prep phase and then follow up with at least the body phase. If you don't want to do the brain phase and do all the, getting the
Mhm.
toxins out, I didn't. I did it all back in 2013, and I spent 7 years just chasing downstream until finally,
Right.
last year I said, okay, I'll get the upstream. So, it can be done, but I think prep and body minimally for somebody who's going to go through these surgeries, if they have other issues going on, to try and clean the body up and get the biochemistry working again. And if you
Mhm.
have issues, again, that's a whole, the whole other ball of wax that you got to deal with. So, working with somebody who can help you figure out what's first, because one of the dentists that I refer to, I love how he does it. He looks at everything. He looks at everything from structure to, the teeth,
Mhm.
jawbone, the airway. And he has a phased out plan because you didn't get like this overnight. You're not going to go in one or two appointments and fix it, right? And most people can't even afford to fix it all at one time if you really want to restore your mouth to optimal so that all you have to go in for is cleanings. And so, but at least okay, this is my first phase. This is how much money I need for this first phase. And then you complete that. And then how I did it is I had to complete my first phase, get that paid off, then go into my next phase.
Right.
So, and I think
And
you have to do that also with your detox and dealing with your Lyme and your mold. It's like, um, how are you going to phase it out so this is an elephant that you can eat one bite at a time instead of
mhm.
going to lay down on you and suffocate you?
And cost always comes up, and I get it. There's things I pick and choose about what I can afford. And the thing to remember is that, what's the cost of not doing anything? How is your health impacted? Right? How's your well-being? Is it affecting your career? Are you missing time off of work? Are you not spending time with your kids because of systemic illness that you don't even know where it's coming from? And you did things, some unconsciously or, just environmental, that you can't really control, and other things that you can control that lead you to be where you are. And you and I look at things from a state of health versus band-aiding and pathology, right? So you can band-aid things forever, if you want, but
Mm-hmm.
things are still going on inside that you can't see, maybe can't feel, that are going to lead you to be less than you want to be. Um, and so if you really want to live and enjoy life and you've got the resources, then by all means, go ahead and do stuff like this. I think it's important. I didn't know anything about cavitations, root canals, the toxins and all of this. And as I've seen people heal through the years doing the dental detox programs, especially what you're doing, you're so incredibly knowledgeable. It's life-changing for people. It's absolutely life-changing. And I want to put it out there that, you're always happy to assist. If people have questions, if they want to work with you, you can help them navigate the process, help them detox their bodies, explain maybe what some dentists can't explain quite so eloquently. You do an excellent job. And I think being informed allows you to make better decisions going forward with your health. So
well, that really is my goal, is to just make people informed so that if they make a choice, they don't have to deal with the emotional trauma of feeling betrayed because they feel they weren't told the truth or the whole story. And, in the defense of dentists, okay, as a dentist and a doctor, you're licensed. So you feel like you're doing, most of them feel like they're doing the right thing. Right. And it's like, I went to school for this. You don't need to know all that. Just let me do what I do and I'm going to fix you up. That is really how they come at you a lot of times. But a lot of that is also has to do with the industry. The insurances kind of set this up where, okay, we give you this much time to work with somebody. And that kind of, even though most dentists don't, biological dentists just don't take insurance. They can't, because they have to spend way more time with you than the insurance will allow them to. And so it gets complicated because there's a lot of factors. It's not just the dentist is a bad guy. He's not telling you everything you need to know.
Right.
Went to school to learn this. I learned this through years of dealing with it and working in the industry and constantly, playing with Dr. Google to try to figure out what Dr. Google is going to tell me, and then taking it to somebody who knows and saying, okay, educate me. Do I have this right? Mm-hmm. And the other thing, I just want to back up where you talked about the investment in health. And I know that you and I know that, but I do work with a lot of people who they haven't gotten there yet. I told my roommate in mid-90s, I think it was 94, I said, I just got this really sick feeling that if I don't change something, kind of a lot of things, I'm going to get really sick. Now, I have trauma around that because my father died of pancreatic cancer. It was very quick onset and not a fun death. But he had lost all his teeth when he was 28 or 29, and he died of pancreatic cancer when he was 37.
Wow.
Never healthy after they pulled all of his teeth. So I was so traumatized by that, though. I just could not wrap my head around the whole idea that I could have the same thing. I mean, I don't know. Nobody talked to me about genetics, I guess. So, while I'm toxifying my body, and really mine was a lot of stress toxins. I mean, when I was off, I partied hard. I played hard. And I went to work. I mean, I don't even know.
I can see it, Karen.
When my kids were little, I took them everywhere. We just went, my kids dancing. I was mother of the year, let me tell you. But I had fun. And that's, for me, what life was about. It was working hard and then rewarding myself with the fun, with the food and all the good things of life. And I'm not going to lie, I had a good time, but it took a toll on me. Mm-hmm. Eventually, I was working in a lot of specialties in nursing. And so when I said this to her, it was really a gut feeling that something was going to happen. And she said, well, then I guess you better make those changes. And I was like, well, you're real comforting, and I didn't make the changes. I just kept kicking the can down the road and had an injury, a nursing injury. And sure enough, from that point on, it was downhill. It was just the downward spiral. And I started with conventional medicine and doctors and Band-Aids and all that stuff, pharmaceuticals. And then I became so ill that I was non-functional, walking with a walker, couldn't hold a conversation because I couldn't get my words out.
Right.
So, and I was spending the amount of money that I was spending because somebody said this might help you, that might help you. And what I didn't realize is even when I left the pharmaceuticals, I'm taking all of these vitamins and supplements. And because I'm taking so many, I'm choosing the brands that are a little less expensive. So I'm clogging up my liver with all of these toxins from these cheap supplements, and I'm still not eating well. And so when I look back at all the money I wasted trying to avoid doing what I really needed to do, I realized that and I say this to people all the time, yes, it is not inexpensive. Or I guess I can just outright say it's expensive to heal. It is. But the money on the front end, I am living proof it will save you money and and a lot of emotional trauma on the back end. It's investment in your well-being. And when we say health, I think people don't connect it. When we say health, it's an investment in how you feel and how you function. And if you don't feel well enough to function, your bank account starts to dwindle and it gets real scary and it creates more stress. So,
it becomes perpetual. I mean,
the
it's
ability to do it. And I know this because I've worked with people who I just don't have the money to detox, but yet I see them traveling to other countries and having a good time. And that's great. If that's your priority, fine. But just know if you are on that trajectory to ill health, you're not going to be able to do that forever. Your body will catch up with you. And the investment is there.
You just spoke to, when you got sick and it just became this, where everything just kind of came out at you, right? Just tumbling out. And I see that a lot, having been in the healthcare field forever. It's like someone will fall and break their leg or break their hip, or, a parent passes away and then boom, everything just comes flooding. And you and I talk a lot to our clients about the idea of an overflowing bucket, and your body can hold on to so much, but then you have that one extra thing that just sends it flooding over. And you can put Band-Aids on it. And I always talk about Band-Aids like saran wrap. It can kind of keep that bubble there, that little, not concave, convex. It's been a long time since I've had math. But you jiggle it, right? Another stress. It could be something so simple as traffic going down the road, and now it's overflowing again, right? Because once you've maxed out what your body can handle, it's going to be every little insult's going to send you tumbling again and again and again. So Band-Aids at some point don't work anymore. And that's why you can take all the meds in the world, and then you can take, like I did, maybe meds to treat the side effects of other meds. And it just becomes this thing. And, if you truly want to heal and live the life you want, you've got to make an investment. And fortunately, a lot of these doctors and dentists are willing to do payment plans, accept care credit or some sort of financing to make it more affordable for you. But I like to say it's a short-term pain for long-term gain. And that's really what an investment in your health is about.
Yeah, for people who don't know, Care Credit and Lending Club, and I know it's harder to get financing now than it was then, but they are still lending for dental, and they have interest-free periods of time, and so you just have to do some planning. Honestly, I sat down with a financial advisor when I was going into all of it, because I had already spent over 200,000 on my Lyme disease, and then I was facing all the dental, and it's like, oh my goodness. But I was able to actually shift the money that I was already spending over here to this. I was getting a weekly massage. Did I actually need it? Yeah, it made me feel better, but it wasn't taking away any of the things that were making me feel so bad and the reason I needed the massage. So what I did is I gave up the massage, and I just took that $180 and I started putting it in an account so that I could get my work done.
Right.
I stopped buying all the things, and I started working with somebody and only taking what I needed. I really pared down, because I had the kitchen, the living room, and the bedroom had places because I had so many bottles of all the things.
Absolutely. Yep.
And I think they were making me sicker, to be honest with you.
Well,
Now,
with the fillers and the toxins in them, and most of them don't have any or hardly any of the actual ingredient they say they do, that I still have cabinets full down there because I hate to throw out all the money that I spent, but I'm never going to use them. But if you take fewer really good quality supplements of what your body can really utilize, and I think that's where like a good quality multivitamin is probably one of the best things that you can take. And, maybe some things to help the body's detox pathways until it's running smoothly on its own. But most people don't need to take a ton of stuff. And, the one thing that I think, well, you and I've talked about this before, the most expensive supplements are the ones you take that you don't need. And you read all these things on Dr. Google, like you need zinc and you need copper and all this. But if you're not taking them synergistically and knowing that if you take extra zinc, it depletes copper and you're not and it's too hard. It's too hard. Take a multivitamin so everything is just in the proper ratios generally and just support your body that way. So
I think this also goes back to the gut health because,
leaky gut, you're not going to absorb
have enough
anything.
of the right kinds of organisms, you're not going to have the biochemistry. I don't care how much vitamin of this or that you take, you can't utilize it because you don't have the organisms to help you utilize it. So, and if the cells aren't taking it up, again, if you don't get that cell repaired, you aren't going to take up supplements that you're taking. So, but people are very, especially when they first leave what I call the sick care system and they move into alternative, it's like this because we still have the same concept. We just transfer, give me a prescription to tell me what supplement to take. And so it is a progression of learning that if you can get your biochemistry turned back on and your gut healed, guess what? You really just need to eat healthy. You don't really need, and that's why I say, sometimes the testing is good if somebody's super sick and you don't know what's going on. I'm not saying people don't need some support here and there, but for the most part, I think if people tackle the biochemistry, if they tackle their gut and do all the expensive testing, if something is going on and it doesn't, right itself, because I know for me, when I do the detox, when I'm paying attention to my gut, I don't need half as much support.
Right. Amen. Amen.
Yeah.
Karen, thank you for coming on and talking about cavitations. And we'll put in your notes, in the show notes, how someone can reach you. The dentist that you work with there in Maryland. I know he's absolutely fantastic. And if anyone has questions, they can always write it in the notes and I'll reach out to you and we'll get those questions answered. So thank you for taking the time today to go over what cavitations are, what we should be looking for, and how invisible they are. And I think it's what we're here for, is to just kind of educate and get people on the path towards healing. So thanks.
Exactly. And I hope, and if anything I said was unclear, because sometimes I just start talking and I don't even remember what I said, or I don't know what I'm saying. But if anything doesn't make sense, please ask for a clarification.
Awesome. Thanks, Karen. And we'll be talking soon.
All right. Bye.